Obsessive compulsive disorder is a complicated disorder that is a combination of nature and nurture, but it's an inherited disorder. It's in West biomedicine would be considered, a function of genetics. And it's important to note that both Ayurveda and Chinese medicine also describe genetic disorders. Ayurveda is especially clear about it. And what we call prakruti, or your inherited dosha that you're born with, your unique combination of vata, pitta, and kapha, is in fact describing in pre-scientific terms exactly what we describe with DNA. It's your blueprint that you're born into the world with. That's the nature part of nature and nurture. Chinese medicine also describes it. We talk about the prenatal qi, the qi that's the quality of qi that you come into the world with. Everybody with any common sense can see that there are many different kinds of human beings. We come into the world very differently, and we're also, depending on, in part, what kind of inheritance you have, that can also determine the extent to which you're affected by the adversity, trauma, and painful experiences of childhood. And a perfect example is, and an awful one, is Joseph Stalin, who was badly beaten as a child and became a murderous dictator. So he didn't develop the kind of PTSD where he ended up being a drug addict and harming himself. In fact, what he did was he harmed others. So he's a classic pitta dosha in Ayurveda. So someone asked me recently, which is better for treating OCD, Chinese medicine, Ayurveda, or Western medicine? And I responded, a combination of all three. But I would explain it this way. The starting point, the number one thing you have to do if you have OCD is you really want to look at mindfulness-based cognitive behavioral therapy, because you need to be able to get some wiggle room between your intellect, your ability to observe yourself, and the behaviors that are part of the illness. OCD involves two fundamental things: pathological behaviors and what drives the pathological behaviors. So it's irrelevant whether what's driving the pathological behaviors is what you're feeling in your nervous system. And it doesn't even matter if you were born that way or not. It's what you're feeling in your nervous system now. So we all have the fight or flight freeze response. We all have that. Every mammal has that. Every animal has that, really. It's how we survive. It's how we avoid being eaten by other animals. And so depending on your dosha, your body-mind type, whether you're vata, pitta, or kapha in Ayurveda, your default response to real or perceived danger will be more fear, which is flight, more anger, which is associated with fight, or freeze, withdrawal, in the case of kapha, which is associated with freeze. Flight, fight, freeze, fear, anger, withdrawal. Vata, pitta, kapha. So depending on your combination of those three doshas and what they look like in your case, that will determine whether you're more of an aggressive person, more of a scaredy cat, or more of the person that numbs themselves with overeating, with alcohol, with substances, things like that. And so each case of OCD is unique, but the commonality is that each case of OCD is unique because each person's unique, and also because some people's OCD can occur in the context of different kinds of upbringings, different kinds of the presence or absence of different kinds of traumas. So mindfulness meditation, mindfulness practice, independent of mindfulness-based cognitive behavioral therapy, mindfulness practice itself is enormously useful for all of us in terms of developing wiggle room, as I call it, between our humanity and our pathological actions and feelings. So, little example, right now there's COVID virus. Anybody who's not feeling anxious about that is probably lying to themselves. Some pitta types who are just enormously courageous feel less anxiety than other types of people, or they feel it and they put it on hold because they jump into action. In any event, right now we're in the middle of the COVID pandemic. We all feel anxious. You can become overwhelmed with anxiety to the point where you can't focus, where you can't get anything done, where you have insomnia. Let's say that's happening. If you have a mindfulness practice and you sit and you practice mindfulness meditation twice a day for 20 minutes each time, it's going to get your nervous system dropped out of that fear, out of that anxiety, which is what anxiety is fear, out of that flight aspect of the nervous system. And it's just simply going to get you back to your normal state so you can be calm in the eye of the storm. That's what it means when people are clear thinkers, calm under fire. So, but cognitive behavioral therapy, mindfulness-based cognitive behavioral therapy, is when professionally trained psychologists use cognitive and behavioral therapy to help you use mindfulness very specifically for dealing with your OCD. Now, there are books that are very useful workbooks for a mindfulness approach to OCD, and I highly recommend that. But if you've never worked with a therapist that's a specialist in OCD, in using mindfulness for OCD, then I would highly recommend it. Because not only are they going to be way better than you are at teaching you how to do that, just like if you want to learn to play piano, you get a piano teacher, most of us. If you want to study most things that we study, some of us can be self-taught, but even those of us who are self-taught will often consult teachers. But not only that, they're going to be able to help you figure out what aspects of that therapy you need. And also, I'm thinking of one patient that I have with OCD. In addition to OCD, he has a lot of childhood trauma involving abandonment, no physical abuse, verbal abuse, and abandonment. And so he's got a lot of issues that he would have even if he didn't have OCD. So he's had to both work through those issues and develop a strategy for coping with his OCD. And everyone's strategy will be different. He's a very jovial character. So part of his strategy is laughing at himself when he wants to do something that to the outside world would seem ridiculous, like checking to make sure the door is locked 5 times. And he'll laugh at himself. And by doing that, he gives himself a little bit of a moment to kind of take stock and step outside. It's like you're dancing and then you stop the music and you step off the dance floor. Okay. So that's the first thing. Second thing is, what does Western medicine do? They use drugs. Can you use acupuncture and Ayurveda and Chinese herbs instead of the drugs? In my opinion, absolutely. If you're doing the mindfulness work. You can't cure with a drug alone OCD, which is why no psychiatrist would just give you the drug and not refer you to therapy to a specialist who does the cognitive behavioral therapy. There's cognitive behavioral therapy that's not mindfulness based. I prefer the kind that is mindfulness based. But acupuncture, so let's talk about acupuncture. What does acupuncture do and how could that help with OCD? Acupuncture directly affects the nervous system. And once again, when you have OCD, your nervous system is activated into a flight aspect of the fight or flight. And acupuncture is going to basically, if I could sum it up this way, it's going to calm you down. It's going to get you calm, which is exactly what some of the drugs do. But not only that, it's also when you see somebody that does classical Chinese acupuncture, we are going to read your pulse, look at your tongue, ask you about your sleep, your appetite, your digestion, your elimination, your menstrual cycle if you're female, a bunch of other things. And we're going to determine what kind of OCD pattern you have in terms of the language of Chinese medicine. So we're going to treat any kind of energetic unbalance in your body that's coexisting with the OCD, with the general principle that everything that you do to be healthier is going to give you the strength to deal with the OCD much better. And we have very advanced acupuncture treatment for mental health disorders. The word for consciousness in Chinese medicine is Shen. Consciousness includes all emotions, all thoughts, all physical sensations, everything about you that makes you more conscious than this rock is what we call Shen. Animals have Shen, consciousness. You can see that there's sweet dogs and mean, aggressive dogs. But when we talk about Shen for human beings, we're talking about everything that modern psychology means when it talks about, or just modern science when we talk about the mind. And the mind but we have this dichotomy in the West where historically, thanks to Descartes, we separated mind and body so that when we spoke of mind, we tend to think about thinking and cognition. But Shen includes thinking, cognition, how your nervous system reacts to things, and also everything that we would describe in terms of emotions, right? Acupuncture is a really useful intervention. You can't cure OCD with acupuncture. Let's be clear about that. But OCD is a perfect storm of negative factors. It takes a perfect storm of positive factors to get better. Notice I didn't say cure. I don't think you ever cure OCD. I think you learn how to live with it in a way that it no longer makes you sick, but the tendencies are gonna still be there, and you'll be dealing with them. And by the way, you can see that with certain professions. I find that a high percentage of musicians and engineers are very, very exacting kinds of people, and they have a different personality. I'm not going to go too far because I don't want to, but they have with this idea, but they have a certain kind of personality type that's very different than, say, ballet dancers, or let's just say dancers in general, who are very athletic and in their body. Very different personality type from lawyers or acupuncturists. So the point I'm making is that there are aspects to OCD that overlap with with perfectionism. Perfectionism can be a good thing, but not if you don't know how to let go, right? Because the hardest thing for a perfectionist, I'm a writer and a musician, and as well as doing this medicine. And the hardest thing for me sometimes is to know when to the thing is finished, when to stop editing. And way back in my undergraduate, I remember a writing class teacher saying, Eileen was her first name, saying that, sometimes you just have to let go of the thing. And just like parents have a problem letting go as their kids grow up, choosing when to guide them and when to let them learn from their own mistakes. Okay, so that's acupuncture. Acupuncture can be very grounding as well. And that's one of the challenges for people with OCD, is to be grounded. So acupuncture is very useful as a partial substitute for drug medicine. Chinese herbs are, I was talking about Shen and consciousness. We have a lot of different points on the body that have the word Shen in them. And that's because they influence mental health and the nervous system and the mind. So you can definitely use, if you're upset about something and you get an acupuncture treatment, you will calm down, full stop. So it definitely has an effect on the mind through the nervous system, because that's what acupuncture is doing. You put a needle in the body, and the sensory nervous system brings a message to the brain inside there that something's happening there. And that's how acupuncture affects the brain. And we know from functional MRIs that that's exactly what's happening. Chinese and Ayurvedic herbs can be very useful for pretty much the same reason, except that, let's be blunt, herbs are drugs. Not all herbs are drugs, not all drugs are herbs. But a high percentage of Western drugs, a very high percentage until recently, less and less now with more advances, were either based on were actually either extracts of herbs or synthetic replicas, like aspirin. So you can take Chinese herbs, Western herbs, Ayurvedic herbs to get once again, to calm and ground the nervous system in OCD, because when you do that, then you, the person with OCD, are in a much better condition for then doing the mindfulness-based cognitive behavioral work. And it's an out of control nervous system and out of control lifestyle that will drive the OCD behaviors. So you can use herbs. I won't get into any specific herb formulas right now. We always base the herb. There's no one herb for OCD. This is how Chinese medicine and Ayurvedic medicine are so different from Western drug therapy. Western drug therapy, it's one size fits all often, not always. There's more than one antidepressant, but there's more than one drug that they use for OCD, but they can give the same drug, single drug, to, thousands and thousands of people. Whereas in Chinese medicine, you're always doing a diagnosis of the individual that takes into consideration a lot of different things. And so that the herb formula generally is going to be modified for the individual. So, for example, an overweight alcoholic with OCD who's hot-tempered is going to get a very different formula than who's hot-tempered and physically hot and obese, is going to get a very different OCD herb formula than a thin, cold, weak, who speaks with a voice like this, thin, cold, weak, very frightened person with OCD who doesn't use any drugs. And I had a patient like this who I had to cover the mirrors because he couldn't even look at himself. Looking at himself made him so frightened. So he's going to get a very different herb formula. So that's important to note. That's why I'm not telling you the name of, take this herb for OCD. There is no this herb for OCD. There are herb formulas that are adapted to the individual. There are basic principles that all of those herb formulas will share, such as calming the Shen, such as warming, such as grounding. But there's going to be a lot of differentiation. How is Ayurveda useful? Ayurveda is very useful for treating OCD as a non-drug therapy, because when you know your dosha and you know how you learn about your dosha. So I'm sorry, let me interrupt myself. I use Ayurveda as a teaching tool to help. It's a framework for self-understanding. One of the ways I use it. So if you came to see me with OCD, for example, and we did an evaluation of your dosha, we're going to determine your primary, secondary, and tertiary, third, dosha elevations now. And we're also, as they are now, and we're also going to look at the very specifics of in what ways are they elevated. And that will then be a template by which I can help you understand what are the lifestyle practices that will be most helpful and what kind of diet to follow. I can tell you that in general, obsessive compulsive disorder involves a high level of vata dosha elevation. But what's important is whether this is occurring in someone whose intrinsic dosha is a vata dominant, or if it's a person who's a pitta dominant or a kapha dominant, because the fact that it's a vata elevation doesn't tell us about your underlying dosha. And so that's again comes into how we modify things. So for example, that hot-tempered, overweight, obese patient I had with OCD, with high levels of anxiety and high levels of anger as well, resentment and buried, that he dealt with through alcohol, self-medicating with alcohol. That was someone who needed a lot of hard physical exercise. So, working out hard in the gym to discharge his adrenaline, because he was fundamentally a pitta kapha type. So he had a lot of drive. He's getting his PhD, and he was a very physically strong person who could go hiking with a 100-pound backpack. So he needs a lot of hard physical activity just to discharge his accumulated adrenaline, but that wasn't doing anything for his nervous system drive. That wasn't doing anything to give him a stress management tool. It was a stress discharge tool. It wasn't doing anything to help him gain any self-awareness. So nevertheless, I prescribed hard exercise to him in addition to Tai Chi, slow kind of Tai Chi, because that guy's, everybody with OCD, their minds are going a mile a minute. So everybody with OCD needs some kind of meditative practice. The best is mindfulness meditation. But sometimes because of the obsession,